So who are you and what do you do?
I'm Bob Kucher. I'm co-chair of the Health Data Initiative. I'm a partner at the venture capital firm Venrock and a non-resident senior fellow at the Brookings Institution.
So you've been watching what's happening with the Health Data Initiative from the beginning.
From the beginning, so this actually began as a joint project between Todd Park and myself while I was at the White House on the National Economic Council, where we had the idea that if we were to liberate the treasure trove of HGS data, that good things could happen. And the first meeting was actually all about the question of, does it make sense to release data and would people do things with it that are interesting? And at that very first meeting 3 years ago, we went to a handful of big companies because there were no little ones and said, here's some data, we'll work with you. Will you help us visualize it, and do you think this is actually a good idea? And GE and Microsoft and Google and a few others said, sure, we'll try it, but almost as a favor. To now where we have 130 companies, most of which didn't exist 3 years ago, who have created businesses out of the data, and several which have become very successful, like Castlight, iTriage, Practice Fusion, and ZocDoc.
Now, some of those are consumer-facing applications, like the iTriage iPhone app, and we've seen some more of those here today. But I'm seeing a trend and interest in terms of empowering caregivers or using analytics to really do other things with the data. Are you seeing that too from where you sit, and what does that mean?
Yeah, I think we've seen an explosion in desire to have analytics inform healthcare, and the combination of payment system reform coming from health reform and from commercial payers to doctors saying, hey, we'll do a shared savings program where you can save in some of the money, is really driving demand by doctors to have tools to help them figure out how to manage their patients and what the costs are and where to refer. And so that's made a big new market, and it's growing very, very fast. Insurance companies are more interested now in analytics and also becoming more consumer, and so being more convenient to work with and frankly, value-adding to their consumers. And then big employers who used to buy sort of one-size-fits-all insurance have become a lot more engaged too on let's personalize your insurance, let's engage you as a worker. And so the number of people who want technologies that take data and make it actionable have exploded, and the desire to engage consumers and doctors in the system has changed radically in the 3 years since we've been doing this.
So we heard a lot about affordable care organizations with Dr. Atul Gawande this afternoon, and he really talked about the need to give people on the front lines of healthcare the data they need to make decisions. That's, again, shifting the context for data beyond just, again, consumer-facing applications to empowering caregivers.
Accountable care organizations are a great embodiment of kind of what the future will look like. In medical school, when I went to medical school, we memorized, hard numbers that we use to treat or not treat a patient, and we'd memorize that on average we should use a certain drug. In reality, we can individualize both the right drug for you and the right endpoint, and having you as a patient understand the rationale and how the plan actually is going to work really helps engage you and make it work better. You can also avoid a ton of complications by bringing data to bear and actually individualizing treatments to you based upon your genetics. And so this is a nice way to bring it together because it's better care and it's lower cost. And it's a lot more fun for the doctor and the patient to be engaged in the actual process of care.
So, last question. I've had a number of other governments and their staff and their media ask me what's happening here. How do we understand this? How do we do this ourselves? What are the things that you'd say to the American people in terms of understanding why this has worked and how other people can learn from it to try to empower their caregivers and really deliver better care to patients?
Well, I think there's no question that combining data and analytics and technology leads to, frankly, more affordable and better health care. That's much better to be a patient in. How do you get it? You actually have to take the leap and share the data and make sure there's really well thought out and proper privacy protections and big penalties for cheating. But you have to make data available in real time that the private sector can use and hash up and do things that public sector employees who aren't facing day-to-day clinical care just won't do in their day-to-day life. So you have to trust the data is going to be a force for good, but then let it happen. And in America, what's so wonderful is that when we have economic incentives and we have entrepreneurs and we have venture capital, you can create great companies and great innovation that then go to scale and make the system work better. This is a great example, I think, of how that comes together.
All right. Thank you so much, Doctor, and look forward to seeing you next year.
Thank you.